Dr. Mendelsohn was closely associated with the mission of making cancer history. He became the third president of the University of Texas MD Anderson Cancer Center. He was also known as President George Bush Healthcare Advisor. By the time he stepped down, MD Anderson had doubled its staff, increased fundraising almost tenfold, and grown hospital revenue from $700 million to $3.1 billion. Our team is grateful for National University of Science and Technology to hold the interview with such an outstanding personality in cancer history. Today we have a very special guest, Director of Personalized Cancer Therapy Center at Texas University. And if you know at least something about cancer therapy, you should know the name of John Mendelsohn, the key figure in cancer therapy medicine. If I would say about all his achievements and membership in different medical organizations, we would have no time for our interview, so let's get straight to business. John, do you think it is possible to find some certain cure from cancer to eliminate it?
Well, there isn't just one cancer. There's hundreds of kinds of cancer, and we're making progress. When I was born, about 1/3 of cancer patients live 5 years. Today, about 2/3 of cancer patients live 5 years, and many of them are cured. But we're never going to get rid of cancer because it's a disease of our genes that are normal, that have become abnormal, and I don't think we'll ever be able to stop it completely. But we can prevent many cases of cancer, and we're improving on the therapy.
Do you remember any special cases in your career when your patient had no chances for survival and finally you had some miracle and you actually helped the person to escape from death?
Well, probably the most exciting miracle over the past 20 years has been a drug called Gleevec for chronic leukemia, chronic myelocytic leukemia. And the average lifespan, once you got that disease before, was about 4 years. Today, 90% of the patients live a normal life. They must take the drug for a lifetime. But it is a miracle, actually, that was designed to attack the product of a gene that causes chronic myelocytic leukemia. In the early stages, it's one gene abnormality. Cancer is a disease of gene abnormalities. We know that. We learned that about 40 years ago. And most cancers, there are many genes causing the trouble. But in chronic myelocytic leukemia, it's one gene, if it's early, and this drug can block the product of that gene. Huge amount of data. So don't smoke. Eat properly and exercise to keep your weight down. And then things like blood pressure and living a more relaxed life, less tension, seem to contribute. And then there's probably 100 little things. And actually there's another thing you don't have to worry about as much in Moscow. But sun can cause cancer. And in the south part of the United States, melanoma, which is a skin cancer, is much more common, and we teach the kids now to put on sunscreen.
So your main idea is that we should lead a pretty healthy lifestyle and we should get rid of all our bad habits, and maybe we will be lucky and have no cancer symptoms. And the last question will be about cancer cells. How do you think? Are we born already with cancer cells, or we get them during our lifetime and they are influenced by our unhealthy lifestyle or some external factors?
Well, the answer is yes, yes, and yes. About 20%, I think, I would guess, of the gene abnormalities that cause cancer are inherited. You're born with those. Doesn't mean you're going to get cancer, but you have a higher risk. And I think much more, like 80%, comes after you're born. The contributions are partly inherited, partly come from the environment, partly lifestyle.
Matter of luck.
Yeah.